Good evening. My name is Agnes Chitsike. I'm presenting on enhancing patient-centered care with technology. My first slide is primary concept of patient-centered care. This emphasizes the understanding of patients' expectations, requirements, and concerns. It improves the flow of communication between the provider and a patient, and also of issues to do with shared decision making. It leads to improved outcomes and satisfaction among patients. Patient-centered care is not only a focus on the treatment of disease, but also an emphasis on the client. It also refers to the size, specialization, and accessibility that can provide benefits to the health of patients due to personal considerations. The notion of one giant health has developed today, and with progress in technology, and we are now able to implement this idea than before. The impact on patient outcomes. This enhances the relationship between patients and providers. It creates continuity in the patient care delivery system and reduces adverse events. It assists in the delivery of dependable data for better patient care. It fosters more self-compassionate attitude among patients. Technology can enhance the status of the patient positivity by providing better communication, reducing medical errors, and enhancing patient-centered care. This is enhancing patient engagement and equality, ensuring that they are fully involved in any health decisions that affect them. Learning objectives. The next slide. The next should be able to list 3 examples of applications that are helpful in patient-centered care. And you should also be able to explain the use of patient-facing apps and patient information management, and develop a digital strategy to integrate these tools into workflows. It means that all the objectives set for this education plan are realistic and can be easily quantified. Our goal is to help you understand not only the concepts, but also how you will be able to actively use them in your undergraduate clinical setting. The next slide is on innovative instructional methods. The methods are simulation and virtual reality. It is practicing using technology in real-life scenarios. Another method is A1-powered learning platforms. It's a personalized learning based on progress. And the last one is gamification, that is engaging in a competitive learning environment. To make this education plan more interactive and impactful, we are utilizing some of the latest innovations in instructional technology. VRS simulations will let you practice using scenarios tools in the live scenarios. A1 learning platforms will customize your learning experience, and gamification will keep things fun and ongoing. The next slide is on virtual reality. It offers immersive simulations of patient scenarios. It allows practice in a risk-free environment. It enhances empathy and understanding through virtual interactions. Virtual reality also can provide a simulation environment or a setting that enables you to practice with patients in a safe manner. This is especially helpful in comprehending the patient's view and enlightening the interaction abilities. The resources that are available for success. We have the LMS platform, internal IT support, clinical champions, VR simulation platforms, A1-driven learning tool, external vendor for gamification. We already have several key resources at our disposal, like our existing learning management system and technological and technical support teams. However, to make this program successful, we will need to invest in a VR platform and collaborative with vendors for gamification tools. Implementation timeline. The months range from 1 to 2, and within that time frame, needs assessment, platform selection, and months 3 to 4, pilot program with small staff group. Months 5 to 6, full rollout to all locations. Months 7 to 12, monitoring, evaluation, and feedback. To ensure that the timeline adopted is reasonable and achievable, the following have been included. It will be helpful to assess the feasibility of using needs fulfilling level for starting with a small group and then progressing to the entire system. It will also be useful that the evaluation will be constant to continue making adjustments as the program continues. Recruitment and communication strategy. Recruitment, targeted email campaigns, department outreach, and staff meetings. Communication, use of digital platforms, email, intranet, posters, department briefings, and contingency plan, use of webinars or live virtual events if tech delays occur. Participant recruiting strategies will involve internal and external emails, posters, and any other available form of communications. If technical delays occur, we are prepared to shift to alternative methods like virtual webinars. Evaluation of success. We have to do pre- and post-conference knowledge assessments, including surveys, clinical outcome monitoring for changes in patient satisfaction and compliance levels, feedback surveys from participants on technology usability and implementation rates of technology tools in clinical workflows. Evaluation is critical to ensure the program success. We will measure knowledge gain, track clinical outcomes, and gather feedback on the usability of the tools introduced, and this will help us refine the program and ensure it is a lasting impact. My conclusion is there's a potential for technology to revolutionize patient-centeredness within the delivery of healthcare. The adoption of innovation will result in improved delivery and satisfaction. Thus, let's make an impact together on the experience of the patient as a customer. Looking into the future, the use of technology in the patient care model will advance even more. Adopting these innovations will not only optimize the results, but also make sure that the patient needs are being met to the optimal capacity. Thank you. Thank you for your attention, and questions and feedback are welcome.